As an overseas nurse looking forward to relocate to Ireland and continue your practice, whilst you are in the process, the best thing you can do for yourself is to start preparing for the Ireland OSCE or adaptation, because these are the two pathways that you would have to go through, one of them to acquire your Irish nursing PIN. So in today's video, I am going to take you through another station of the Ireland OSCE for psychiatric nurses. And that's the anxiety de-escalation station. This is a major station of the psychiatric OSCE. If you are interested and want to know more, please stick and stay with me. This is Nurse Sabina. I am a Ghanaian trained psychiatric nurse, currently living and practicing in the Republic of Ireland. And this is my channel. Please do subscribe, like, comment, and share. Let's get started. Welcome back to my channel, guys. So in the anxiety de-escalation station, I said earlier, this is a major psychiatric station in the Ireland OSCE for overseas psychiatric nurses. The objective for this station is to help this patient who is very anxious to actually connect with the here and now and gain control to regulate her emotions and behavior. So there are a lot of techniques that you need to display in this station in order to achieve this goal. So in this video, I am going to take you through some of these basic techniques that you need to put up in this station in order to secure your success. I know this will go a long way to help others, so please share with fellow overseas nurses to grab this information, and keep on subscribing, like, comment. So before you even enter the station, you have the descriptor outside, which will tell you some of the major tasks that you need to do in the station. Failure to do any of those tasks, know that you have failed the station. So I am going to help you in this video too. So fast forward, as you enter the station, remember to do your checks. I have done a video on that already. Please visit that video and grab all the necessary checks you need to do in every station. Another thing you need to do is also to establish a very good rapport with this patient, okay? Because this is a patient who is very anxious, pacing around in the unit, seeking to help to talk to the doctor, because she's actually losing control of her behavior and her emotions. So you are there to offer the necessary emotional support to this patient. Now look around the station. There are some things that you may see, and those things should give you clues of what you need to do. So when you look around the station, you are going to see something like a bed, you see a chair, you see a paper and a pen, you see a bottle of water, and you are likely to also see a magazine. All these things are there for a purpose, and they are to give you clues of what to do for this patient. So be very observant as you enter the anxiety de-escalation station. After identifying all these things in the station, now you need to put yourself into action. So the best thing you can do is to get this patient to sit on the chair or sit at the edge of his or her bed, and now take her through some of the techniques expected to do. Remember, I told you about the descriptor. The candidate is expected to, let's say, conduct deep breathing exercise, some guiding imagery, and some diversional therapy, offering reassuring statements. The descriptor will tell you all this. So grab that information before you enter the station. When you're going to do the deep breathing exercise, introduce it to the patient. Always remember to seek their consent. Don't just do anything for the patient. Seek for the patient's consent. Get her to sit comfortably and upright in the chair, or get her to sit at the edge of her bed. So introduce the 555 rule to her, and this is how you do it. So let her know that you are going to engage her in a deep breathing exercise, which will make her feel relaxed. So first of all, you want her to take in deep breath for 5 seconds, hold the breath for another 5 seconds, and breathe out for 5 seconds. So that is the 555 rule for deep breathing exercise. Let her know the rationale while you are doing the deep breathing exercises with her. Another thing can also be the pen and the paper that you see in the station. Introduce the paper and the pen to her. Ask her, would you like to write down anything that you want to discuss with the doctor when he comes? That is another way of distracting her mind from the anxiety symptoms that she's experiencing. So you can also introduce the pen and paper in that way. Another thing may be the bottle of water that you may see. Find out, do you care for a bottle of water or a cup of tea or coffee? Sometimes the patient may say that I feel dry mouth. Quickly intervene with a bottle of water or a cup of tea or a cup of coffee. The bottle is there for you to make use of it. Another technique you can introduce in this station to secure your pass is the guiding imagery. This is actually a technique that you need to make use of the bed. So the bed in the station is also for a purpose. So in this therapy, you are encouraged to close your eyes and imagine an event or a place that you once visited that was so peaceful and relaxing for you. Seek for her consent. Would you like us to do it? If she gives you the go-ahead, you get her to lie down on the bed, close her eyes, and then lead her through this technique. Ask her, where do you find yourself? What was this event about? Then she'll start talking. So in this station, you are expected to demonstrate this kind of technique with the patient. The magazine is also there for a purpose. Don't forget, you can use the magazine for diversional therapy. How do you introduce this to the patient? Do you want us to go through the magazine? If she says yes, you can use the magazine as a diversional therapy with her. So go through the magazine and interact with her. It relaxes her mind from the anxiety symptoms. If you are able to do all these techniques in this station, your pass is assured. In this same station, your assessor may ask you to escalate the situation to the consultant psychiatrist using ISBA. Yes. Visit the video I posted on aggression de-escalation station. You get to understand how you can also briefly use ISBA to escalate the situation. Another thing you should not forget to do in this station is constantly offering reassuring statements to the patient. So you can say, I am here to give you all the necessary supports that you may need whilst we wait for the doctor. I am not leaving your side until you gain full control of yourself. These are reassuring statements that the examiners would want to hear as you carry out your techniques with the patient in the station. Another thing you are expected to do in this station is a care plan. Yeah, the good thing is it's a very simplified care plan that they will draft for you to do, and it's mostly requests for problems that you identify and then the interventions that you were able to carry out. We all have an idea about care plan, so don't forget your knowledge on care plan. You will implement it in the station. Just do all these techniques with confidence. That's what matters. Last thing you should not forget to do in the station is your documentation. Always document whatever you have done for the patient. Document it or verbalize it. It saves you from any failure. Documentation is key in all the OSCE stations. I hope I made sense in this video. Please do subscribe, like, comment, and share. If you find this video very useful, please give me thumbs up in the comment section and share with fellow overseas psychiatric nurses that are looking forward to take up the Ireland Psychiatric OSCE in order to acquire their Irish Psychiatric nursing pin. This channel is always available to help. So please do subscribe, like, comment, and share. This is Nurse Abena. I am a Ghanaian trained nurse currently living and practicing in the Republic of Ireland. And if you are an overseas psychiatric nurse preparing to take your Ireland OSCE, I wish you all the very best. Go through my playlist. I have few videos on the OSCE stations that will go a long way to help you. Do share with your fellow colleagues, and together we win. I can't wait to see you in Ireland practicing as a registered psychiatric nurse. I'll come your way another time with another informative and interesting video that will help you through your journey of becoming an Irish nurse. Please keep subscribing, like, comment, and share. Bye-bye.